Hi, and thank you for being here for our presentation today. We are presenting on our project, Opportunities to Address the Needs of Essential Working Parents and Their Children. This was done with the Emory COVID-19 Response Collaborative. The faculty at Emory we've been working with are Dr. Julie Gazmarian and Dr. Sarah Blake, and our contact at the Georgia Department of Public Health is Ebony Thomas. These are the Emory students that we've worked with. I'm Emma Clevenger, and I'll be presenting today with Elisa Lindsay. So first, we'll start with a brief background on our project objectives, as well as our sites and participants. The objectives of our projects were to understand the challenge that vulnerable families face that impacts the health and education of their children during the pandemic, and to identify the strategies and resources to assist these schools with meeting the needs of vulnerable families. So in choosing our project sites and participants, we wanted to make sure that we included a variety of geographic districts, as well as include both urban and rural communities. So you can see here that we chose these communities on the map, Early, Hall, Lowndes, and Lumpkin. And we chose to interview 3 school administrators from each school, the principal, assistant principal, and the school nurse. And as we did focus groups with parents and guardians, 3 focus groups per school of parents of children in kindergarten through 3rd grade whose parents are unable to work from home.
So we did 12 administrator interviews, and I'm going to briefly talk about our key activities, initial findings, and next steps. So in our key activities, in November of 2020, we started by distributing a brief survey to school principals, and we piloted our interview guides for administrators and school nurses with other administrators and school nurses in the Georgia area that just weren't in our initial schools that we participated with. And in November and December of 2020, we had in-depth interview training for our graduate research assistants, and that was just about best practices and how to conduct interviews. And then we began conducting interviews in December of 2020 and ended in January of 2021. And that was 8 school administrators, so principal and assistant principal, and 4 school nurse interviews. And in January and February of 2021, we began cleaning these in-depth interview transcripts. So as I mentioned earlier, we distributed a survey to administrators, and here are the initial findings. There was a total of about 800 students in kindergarten through 2nd grade in Early, Lowndes, and Lumpkin County, and about 500 students total in Hall County. Out of all of those students, 100% of them were eligible for free reduced breakfast and lunch in Early, Hall, and Lowndes counties, and about 50% of them were eligible in Lumpkin County. So going through the race and ethnicity information that we discovered, we looked through the top 2 groups in each of the counties. In Early County, there were about 75% Black students and 20% white students. In Hall County, there is about 75% Latinx students and 20% Black students. Out of those 75% Latinx students, it is important to note that 70% of them speak primarily Spanish at home. And then in Lowndes County, there are about 43% white students and 35% Black students. And in Lumpkin County, about 87% of students were white and 12% other. So again, this information was collected in November of 2020, and something that we immediately noticed going into late fall semester, early spring semester, is that most students, especially students in rural counties, were learning in person, and not a lot of students were learning virtually. Out of the students that were learning virtually, most of them were older in 2nd grade. And in those interviews that we conducted with school administrators, we covered a variety of topics, including their background, current position responsibilities, the transition to virtual and hybrid learning that they went through, the nurses' role in learning modalities, and the mitigation strategies and PPE that they use in their schools. We also asked them to identify the resource, or how they identified their resources for essential working parents and their children, and how they outreach to those parents and did contact tracing with them. And then finally, we asked them, looking forward, what modalities would they offer in following semesters, as well as what support did they need from the Department of Public Health or the school district.
The next part of our project was the Essential Parent Focus Group, so I'll be discussing those key activities. We began by establishing a parent eligibility tracking document that we used to determine how we would screen eligible parents. and we collaborated with principals from each school on parent recruitment. We developed a protocol for the focus group, as well as 2 focus group guides, one for parents of children who had an in-person learning modality and another for parents who had chosen a virtual learning modality for their children. We piloted the focus group guides with a group of parents from schools other than the ones that are part of our study. And then we were able to screen and enroll 21 eligible participants from the schools in our study. And most recently, we have scheduled focus groups for the Lumpkin County parents to take place on March 22nd and 23rd. So during our focus groups, we will cover the following topics. Before the discussion starts, the participants will complete a Qualtrics survey that will collect data on demographics, work requirements, health insurance status, COVID vaccine attitudes and intentions, and COVID-related distress for parent and child. Then during the focus group discussions, we will discuss general child well-being, healthcare utilization during the pandemic, satisfaction with the current education method, and communication with the school, whether that be about academics, COVID precautions, school opening, and options for learning modality, as well as overall resources and barriers during the pandemic. The following are the project applications from our findings. We got to collaborate with the Department of Education to develop supports and resources for essential working parents, and collaborate with them also and along with local school districts to cultivate policies and procedures that provide flexible options for parents with different schedules and needs, and develop innovative strategies that support essential working parents who are not able to work from home during this time. Thank you for coming to our presentation today, and we look forward to taking your questions.